Who is Dr. Peter G. Hill? He's your chiropractor in Weston. He's licensed in Massachusetts, New York, and Connecticut, trained in New York, and spends his free time volunteering, hosting a podcast, and being an advocate for fathers' rights. Why chiropractic? Because it's safe, natural, and effective. Helps with neck, back pain, sciatica, headaches, and low energy. He's my chiropractor.
Hi, I'm Dr. Peter Hill. I'm a chiropractor in Weston. I've been in practice for 25 years. I spent 25 years in Boston, in the south end of Boston. I recently opened up full-time in Weston. Today I'm giving a talk about the anterior cruciate ligament and the ACL as it's known, and how to prevent injury to your ACL, and what to do if you do get an injury, and whether you should, if you can have conservative treatment or not, depending on your injury. So why don't we get started? So what we're going to talk about is, again, ACL injuries. What are they, and can they be prevented? So who gets injured? So basically, when we run, we jump, and cut without thinking, the body, the nervous system really coordinates everything. Your brain, your spinal cord, it coordinates all the activity of your body, where you stand in position, and where you stand in, and how you land, cut, and turn for your knee. Only maybe 1 in a million run, jump, cuts will result in a tear to your anterior cruciate ligament. And usually if you do tear it, it's near the top at the insertion of your femur. Now, your leg is comprised of your thigh bone, which is the femur, and then you have the shin bone, which is the tibia, which is the two large bones. So really your knee joint is made up of your thigh bone and your shin bone, and then your patella or your kneecap. So there's been a tremendous jump in injuries of children, young adolescents, for knees. The ACL tears have increased 400% from 1999 to 2010, and the most recent jump has been from 2005 to 2010. And this has really been evident in all groups. And there are many possible causes. There's more intense competition. There's more year-round training. For instance, there's summer sports and winter sports and spring sports and fall sports. And a lot of times children are not getting, and adolescents and teens are not getting the time to really rest their body as they've done in the past. It makes them more prone to injury. The other thing is there's been a lot of increased diagnosis, referrals, and there's more aggressive treatments, because it's very important. Very often we want to be a very active society, and for kids to get back on their feet and get back into activity. The ACL, the anterior cruciate ligament, it's estimated there are about 100,000 injuries per year. It costs about $1.7 billion to treat all those injuries. There are both short-term and long-term consequences to it, and it's much more common in females. It's been estimated to be 2 to 8 times greater risk. And we'll talk a little bit about why women are at greater risk for ACL injuries compared to male athletes. What causes an ACL injury? 70%, believe it or not, are non-contact. That means no one's run into you, no one's tackled you. You've done it all by yourself. And there's sometimes people are all alone on the field and they've torn their ACL. So usually it occurs towards the end of the day when people are tired, when athletes are tired. So what's also recommended is that you try to recommend that they don't run down a hill at the end of the day when they're tired, because it makes it much more likely to be prone to tear their ACL. Body position is paramount. Understanding where the body is in space, where your knee and your hips are in space. So when does the ACL tear? It tears when your hip is straight, when your leg is straight, and when you land flat-footed. That's what the odds are. Because what happens is when you do that, you're not engaging all the muscles and ligaments of the body. The body is not really prepared. Even if you just land with a slight bend in your knee, you're engaging the muscles, the ligaments, the collateral ligaments, and the ACL and the post-ACL in a fashion that allows it to work and prevent the rotational tears. So what causes the ACL to tear? It's valgus stress, which is a lateral stress on the knee with torsional rotational component. So it's a lateral and a rotation of the knee. So one of the things you can do to see if your child is at risk, and I'll just demonstrate it, is have your child jump off a chair. And I'll do that now. So what you'll do is you have your child get up on a chair, and they'll stand in neutral position, and then you're going to ask them to jump down. So they jump down, and their knees go inward on their landing. Your child's more at risk. So what you want to do is make sure that the child understands, and you watch what they do to tell them is to land so the knees don't bend in, don't bow in. Just land and come straight down. And that's really a little bit when they're going to be landing is how it's really important for them to be aware of their body position. So let's talk a little bit about the anatomy of the knee. So the normal knee, you have a kneecap, which is your patella, which is your kneecap, your femur or your thigh bone, as I said, your tibia, which is in the lower leg, which is on the inside of the leg, your fibula, which is not really part of the knee, but does attach the lateral collateral ligaments on the side portion, the lateral portion of your leg. Then you have the articular cartilage and the meniscus, which they are the shock absorbers for the knee. And the articular cartilage run along the inside of the patella, which is your kneecap. It runs at the base of your femur, just at the very bottom of your femur, and at the very top of your tibia. And those act as little like cushions when you jump and fall. And those have to really be intact to protect the body. So the anterior cruciate ligament connects the femur, the thigh bone, the tibia, the shin bone, and prevents the tibia from sliding forwards beneath the femur and provides stability to the knee. Tearing of the ACL can occur when the bones twist in opposite directions during an impact, such as landing from a jump. So the anterior cruciate ligament, which goes from the middle of your femur to your tibia, and then your posterior cruciate ligament, which runs the opposite direction from the back. And so the anterior cruciate ligament prevents forward motion of your thigh bone over your tibia. And the function of the knee is to cut and pivot. The knee is both form and function to control performance of your knee. It is a load-bearing joint, so it carries your weight. It acts to distribute loads. Its ligaments tighten the knee. So ligaments attach bone to bone. So your anterior cruciate ligament attaches your femur, your thigh bone, to your tibia, your shin bone. It attaches bone to bone. And the meniscus, as I said, distribute forces. And the meniscus is the cushion that you see over here. Kinematic function of the knee, the ACL prevents anterior, which is called forward motion of the knee, and the forward motion of the knee over the femur. The ACL acts to keep the knee stable as one lands on the ground. It's sort of like a very taut rubber band that protects you from having a lot of motion. So what are some of the other risks that cause you to maybe tear your ACL? And the questions are, does whether you play on a grass field or if you play on an artificial turf, does that matter? The research shows it doesn't matter. Whether you wear a different type of shoe, whether it be Nike, Reebok, with cleats, without cleats, that research shows doesn't matter. Believe it or not, they've shown, and it's still not 100%, but there is some indication that the time of the hormone cycle of a woman does matter. So recent studies show that there are more ACL tears at the very beginning of a woman's menstrual cycle. So if you have a young athlete and she's at the very beginning of her menstrual cycle, you just may want to make her more aware, to be more aware of her body position when she goes out to play soccer or field hockey or lacrosse, just to be more aware of her body. The other thing that matters is something called the Q angle. And the Q angle is an important predictor of biomechanical abnormality. Normal ranges are 18 to 22 degrees, and women are at a higher range due that they have a wider pelvis. Now, the way you would measure the Q angle is if you touch your pelvis, you can feel a little bone over here. It's called the anterior superior iliac spine, and then your kneecap. And you draw a line that goes from the anterior superior iliac spine down to the kneecap. Then you have another line. There's something called the tibial tuberosity, which is a bump just below the kneecap. And you draw another line from there to that kneecap going up. That angle shouldn't be greater than 22 degrees. If your child has an angle that's greater than 22 degrees, they're more at risk for tearing their ACL. You might hear 1 or 2 or 3 pops. The leg pop, knee moves and twists, and the knee pops back in. Very often people have instant pain. They start getting instant swelling. Blood pours into the knee. The best thing is to lie and wait for help and get off the field. There are some people on rare occasions, even after they tear their ACL, they can continue skiing, can continue running, they continue playing sports, and they've torn their ACL and they can still do it. But the majority of people, when they tear their ACL, they really can't continue. So the next thing you need to do is go to a medical doctor or a chiropractor, get evaluated. It's possible you may need an X-ray and an MRI, and to see what is the status of the ACL tear. So what happens next? You want to determine what type of tear you've had of the anterior cruciate ligament. You want to determine if it's a complete or a partial tear. You want to decide whether you're going to have therapy or if you're going to have surgery. Surgery, once you do have surgery, 50% don't perform as well, but still 50% do perform just as well after having surgery. Almost all return to some form of sport. About a third of people who tear their ACL stop doing all sports whatsoever. So who can decide whether you can do rehab versus surgery or not? It's really a personal decision between you and your doctor, which way you want to go. And there's certain factors that will influence which way you want to go with an ACL tear. So if you have a partial tear and no instability, you can possibly avoid surgery. If you have a complete tear and no symptoms and knee instability during low-demand sports, and you're willing to give up the high-demand sports, you may not have to have surgery. The other people, if you do light manual work or live a sedentary life, you also don't have to have ACL surgery. And finally, those who have growth plates that are still open, children, really should wait before they have ACL surgery on their knee. That's what the research shows. One of the other big questions that people have is, once they tear the ACL, what are the odds when they become an adult will they develop arthritis in the knee? It's a very common problem that after you tear the ACL, that you do develop arthritis down the road. So the most important factor to prevent arthritis down the road is to restore the normal range of motion of the knee. That is by far the biggest predictor. If you can get the biggest range of motion, get your knee going in all the directions past 90 degrees to keep you for the rest of your life. And you have to be very vigilant about range of motion. One of the other predictors is that if you don't tear your meniscus, the ACL can be repaired multiple times, but the meniscus cannot really be repaired as well. It's tissue that can't be just regenerated or replaced. With the ACL, they can take grafts and they can rebuild an ACL. So if you tear your meniscus, you're at greater risk for developing arthritis down the road. So one of the most important things is for a surgeon is not to remove your articular cartilage or your meniscus. If they do remove it, your odds of getting arthritis increase dramatically. The other thing that does matter is who the surgeon is you pick. If you do have to have ACL surgery, it's really important you choose a surgeon who does a lot of multiple surgeries. You don't want to go to someone who's not an experienced ACL surgeon. It does matter. We're lucky in Boston that there are many qualified ACL surgeons who do a lot of knees. Finally, on the long-term outcome, it really almost doesn't matter whether you have surgery or not sometimes. But if you want to continue with sports on a very active level, then ACL surgery might be for you. So what are some of the things we can do to prevent getting an injury in the first place? The way you want to work on to avoid injury, you want to work on your agility, your flexibility, your strength, proprioception, having the knowledge of where your hips, knees, and feet are in a three-dimensional plane. It's being aware of your body position, knowing that your knees are bent, knowing that your hips and pelvis are engaged, that your muscles of your legs are engaged. That's what can help prevent it. So there's a video, a 4-minute video, which I'd like to present to you, which will go over some of the exercises that should be done on a regular basis when your child is working out. And this should be done, it's about a 4 to 5 minute video, but about a 10 to 15, 20-minute workout that every child should do before they start doing their activity to help them get ready for the sports to prevent an ACL injury.
PEP, which stands for Prevent Injury, Enhance Performance, consists of 5 aspects: warm-up, stretching, strengthening, plyometrics, and agilities. It is important to remember with all of these steps that speed is not important. The participants need to focus on the quality of the movement and proper positioning. The warm-up is the first step in the program, and this is accomplished by completing a jog shuttle run and a backwards jog from one end of the gym and back. This is an important process to prevent any strain on the muscles later in the program. After the muscles have been warmed up, the next step is to stretch. This helps to lengthen the muscles and help prevent injury. Remember that all stretches need to be done twice for 30 seconds each. The first stretch is a calf stretch. For this, you will need to be in a push-up position and place one leg straight. Put your opposite foot on the back of the heel and push down. Remember to keep your torso parallel to the ground. The next stretch is a hamstring stretch. Sitting on the ground, place your legs in a figure 4 position. Turn your hips toward your toe and with your back straight, lean forward. For the inner thigh stretch, while seated, turn your legs outward. Keep your back straight and lean forward. The Piriformis Stretch is completed while laying on your back. Put one leg up and rest the opposite foot on your knee. Grab underneath your knee, lean back, and pull your leg toward you. For the standing quad stretch, stand upright, grab your ankle behind you with the same hand and hold for 30 seconds. For the standing hip flexor stretch, you will begin in the lunge position, pushing your hips forward and leaning backward. You should feel a stretch in the front of your thigh. The next part of the PEP program is strengthening. Increasing muscle strength will help support the body to help prevent injuries. The first exercise is the calf raise. Standing on one leg, raise your heel and hold for 2 seconds. Complete 2 sets of 30 for this exercise. The next component in strengthening is a walking lunge. Begin by taking a long stride forward, then drop your back knee, and remember to not let your front knee go farther than the tip of your toe. Keep your shoulders over your hips at all times. Complete increasing sets of these in 10, 16, and 20 increments. Russian hamstrings. While on your knees with your ankles supported, lean forward, and while keeping your body straight, feel the stretch in the back of the hamstring. Return to your starting position. Do 3 sets of 5. Bridging. While laying on your back with your knees bent, raise your hips and lift alternating legs. Remember to not drop your hips while performing this exercise. This exercise requires 30 reps. For the plyometrics phase of the program, it is important to remember to control the body's movements. The height of the jump is not important. We are focusing on the landing while trying to keep the knees and feet from caving inward. The exercise includes lateral hops, forward and backward hops, single leg hops, vertical jumps, and scissor jumps. These should all be done in sets of 20. And again, remember not to let fatigue allow poor technique. The final step of the PEP program is agilities. Again, speed is not important. The emphasis should be on staying low and maintaining stability. The first exercise is a shuttle run. In a diagonal pattern, run to the first cone, then backpedal to the next cone, alternating between each one. The next agility exercise is a diagonal run, in the same format as the shuttle run, except we are always running forward, and at each cone, plant with the outside foot and turn at a 45-degree angle to run to the next cone. The final exercise is a bounding run. From one sideline, run with your knees up toward your chest. Landing on the balls of your feet, remember to bend your knees and keep your hips straight.
Just finally going over, if you have any questions, please feel to give me a call. I'm Dr. Peter Hill, I'm a chiropractor. Thank you.